Welcome to Nourish MD, Doctor Dietitian Dialogues, where doctors and dietitians empower you about your health and discuss and provide a better path to health and wellness. Proudly presented by Concierge Medical Practice, Private Physicians Medical Associates, PPMA, with your host, registered dietitian and nutritionist, Meg Tancredi.
Hi, everyone, and welcome to Nourish MD, the podcast where we learn, grow, and nourish together. I am your host, registered dietitian Meg Tancredi, and today we have a fantastic guest, a very dear friend of mine, and a fantastic psychologist, Dr. Kristen Kvamme. Today we are talking about a very important topic that all of us can relate to on behavior change, and it's a very perfect time of year to be talking about this. Before we get started, I would love to read her biography so we know where Dr. Kristen is coming from. So Dr. Kristen Kvamme is a licensed psychologist and functional nutritional therapy practitioner who helps people create lasting lifestyle changes by focusing on the process of behavior change, not just the outcome. Ooh, I love that. Through her private practice, she works with professionals to build realistic habits around nutrition, movement, and self-care using evidence-based psychology, identity-based habits, and small incremental change. Her work emphasizes consistency over perfection, helping people design routines that actually fit real life and stick beyond the new year. This is so perfect. So Dr. Kristen, thank you for being here.
Thank you for having me.
This is so perfect this time of year because have you had a lot of people, a lot of your patients, a lot of maybe family and friends say, hey, what are your New Year's resolutions?
It's definitely been a big topic. I think about half of the time people say, oh, I don't like New Year's resolutions. I don't believe in that. And the other half are doing maybe vision boards or they're thinking about intentions. What I notice with people who are reticent is they feel overwhelmed by resolutions and they feel like they don't work.
Yes, I totally get that. I have noticed that generally speaking, when people make resolutions, there are these very lofty, big goals, right? Mm-hmm. And it's great to dream big and be optimistic because most of us are at the beginning of the year because it feels like the reset. And so we think, okay, I want to, and in our world, usually it's, I want to lose weight or I want to feel better, something that's a really big statement. Mm-hmm. And so, oftentimes maybe just a couple of weeks go by. And if you check back in with that person, hey, how's that goal going? It's, I gave up because they either don't know what direction to go in or how to break that down. Is that what you're noticing, that people are setting these big goals and then they kind of get stuck and then what do you do?
Yeah, they don't even get started, or maybe they get a few days in. They're really focused in on the outcome. I want to lose weight, or I want to go to the gym every day, or I'm gonna write in my journal every day, or whatever it might be. So they're thinking about like what they want to, the place they want to get to, and they're not thinking about the incremental change that needs to happen to get there.
Right, because that means that they're focused on the outcome, right? Which is what in your bio you were saying, that you help people focus on the behavior change and not just here's the result I want. So.
Because it ignores the reality that you've been spending your time doing other things. So if all of a sudden you're going to go to the gym every day or make homemade meals or whatever new time-consuming activity, that's ignoring the fact that time has already been allocated somewhere else. So we need to start slowly and build these habits into our lives and create new systems.
Exactly. So when you say build new systems, what could that look like for someone? So if I like to use the example of, maybe, reaching the healthier weight, because a lot of people do talk about that in my office, and I'm sure in yours too. So if we were to say, what are the new systems or processes that person would need to do if they wanted to, have that outcome of reaching the healthier weight?
Mm-hmm. That's a great, looking at building a new system is a great way to look at it. Part of the frustration to achieving these goals is it takes a lot of consistency and dedication. So if we go to the gym every day for a week, we're probably not going to see dramatic results. You
True.
might see that you're sleeping a little better or that your mood's a little better, but overall, it's not going to be a dramatic change. So people get frustrated and they give up. So we want to really focus in on a lifestyle. So if I want to lose weight, that's also a very arbitrary goal, may or may not be achievable. It might be helpful to step back and say, what does that goal represent to me? My goal is I want to lose weight. Really, what that represents to me is that I would be healthier. So what are the things I can do every day to be a healthier person? And just focusing in on those small changes and building a system in your life of being healthier that is sustainable, that would move on beyond 2026 and through the rest of your life.
Right. Yeah. So I think when when suggestions are made, right? Like, hey, okay, you've got your goal, you know where you want to go. Let's break it down into, small bite-sized habits that work for you every day. And we go to the gym, right? So they've been able to plug in, hey, I can go to the gym 3 days a week. And let's say 2 weeks goes by and it's like, well, wait a minute, there's no change happening.
Mm-hmm.
Like that change that I want is not happening, right? So how often do you end up talking about like patience, or just focusing on, instead of focusing on like that outcome that's like way down the road? I mean, how do you shift someone's mind back into like now?
Well, again, I think it's like redefining that goal. So if that's a lofty goal, if I were to have a goal today, let's say that I'm going to run a marathon this year, I'm not going to do that today or next week or next month. And so that's a goal that I would plan several weeks, several months to achieve. And a lot of our goals that we have, if we're moving towards a healthier lifestyle, is going to be more long-term. So let's break that goal down. You mentioned that, kind of like breaking it down. So if this is my goal, what are steps I can take now? So you might even want to look at it as in like segments.
Mm-hmm.
This month, I'm going to work on meal prep. And I'm going to, where I like to say, for exercise movement. So I'm going to try to move 20 minutes a day, and then I'm going to expand that as the weeks go on.
Mm-hmm. Have you ever had to dial something down so small to where maybe somebody looks at you kind of funny, like, wait a minute? So for example, I'm sure you read this book, the Atomic Habits,
Mm-hmm.
right? And so in that book, the author references somebody who had this goal of going to the gym. And they said, okay, all I want you to do is, I think it was like, put on your shoes, get in your car, and just drive past the gym. And then, it wasn't even, I want you to go work out for the day. It's like, we're gonna just get to the gym and turn around and come back home. And the person responding was like, this sounds really bizarre.
Right.
And then the next step was, I want you to walk into the gym and I want you to leave. And then they kept building it, right?
Mm-hmm.
Until he finally was able to, he got on the treadmill, he did 5 minutes. And then over time, he was like, oh, wow. And he just started to train his brain and had that, oh, this is where I'm going to end up, which was on the treadmill, moving and grooving, right? And so I always think about, how do we convey to somebody who wants to have this big goal, it's okay to start really, really small, right? And
right.
to
Absolutely.
remind them that.
We have a tendency to think in very black and white thinking. I've heard people say many times, I don't have time to eat well right now.
Right.
Or I don't have time to exercise right now. They're thinking of this very black and white, all or nothing, predefined sense of what that means.
Right.
And I think we always have time to make better choices than we've been making. And I think that what you just described is also aligned with what I was saying about ignoring how you've been spending your time doing other things. So if we were to think of the ride to the gym and back is beginning to create space in our schedule for this routine and then expand it. So now we've created a habit around maybe time of day and a certain amount of time, and then maybe over a couple weeks or so that expands. And so we often just throw those kinds of ideas out, like, what's the point? But the point is we're establishing a habit that's going to become consistent.
Yeah.
Habits are better, easier to maintain when they're easier to do.
Right. Exactly. And that they carry value too, right? Like you have to want to be healthy. Like, yes, we all want to be maybe thinner or more agile or more energy, but like it also has to be internalized too, right? Where you value it. But I want to go back to the black and white thinking, because I've heard we've had a lot of off-camera conversations, and you've talked about when it comes to thinking black or white, right? We can't see those other options that we could be doing. So if it's something like, oh, I can't get to the gym today, instead of thinking, well, if I can't go, then I do nothing, which is the black or white. Right. So you've said before, it's like, well, but there's different options. There's like the variants that we can do. So like, what would that look like in with the example of the physical activity piece?
Sure. And the one thing I suggest to clients is to like write this down ahead of time. Make a list of movement options ahead of time. In the moment, we often are not very creative with our ideas, and we'll like, I can't go to the gym. Well, I don't know what to do.
Right.
So I'll say, make a list for yourself of things that would be helpful, and then ask yourself, what would feel good today? I don't have time to go to the gym, but I do have 20 minutes. What could I do in 20 minutes?
Yeah.
Right.
I like that. And then it's kind of like the choice is yours still. So you can't go to the gym for whatever reason. And then now it's, what can I do? What feels good to me? And then, like you said, ahead of time, you've maybe created a list of movements or anything that counts as exercise that you could refer to and be like, all right, I can do that one. And that is better than nothing. Absolutely.
Right. And simple math exercise is 20 minutes of stretching may not feel that helpful. But if you think of over the course of a year, if you were to stretch 20 minutes one time a week over the course of 52 weeks, that is impactful.
Yeah.
And so it's really zooming out and making that and looking at the overall benefit and making that commitment to show up for yourself, even when you don't, let's say, feel like it, but knowing that there's options. We're just trying to maintain a habit. Like every day, first thing I do when I wake up is I move my body somehow. And then that becomes a habit, that becomes a routine, and that over time gets easier to follow through on that, and that consistency has that compounding effect.
Yeah, exactly. The compounding effects. I love that phrase. When it comes to no matter how small the step is, whether it's the guy driving past the gym or finding the 20 minutes of stretching once a week, how important, even on a scale of 1 to 10, do you think it is to celebrate the wins?
Oh, I say that we should celebrate our little victories every day.
Yeah. Yeah.
Be proud, be like, acknowledge that there's a lot of neuroscience behind that. We have a tendency to be really hard on ourselves. Yeah. And we have this false premise that if we're hard on ourselves, like we'll work harder. If we have this critic voice that says, oh, you should have done more. Oh, you didn't go to the gym for the whole hour or whatever it might be. We think that's going to fuel us, and it actually doesn't work that way. It just really drains our energy and our motivation. So I think we've talked before about even tracking your exercise and using that as a motivator to see for yourself how much you've accomplished.
Yes. Yes. Because I laugh because if I were to say, what did you have for lunch, 3 days ago, especially like when I'm talking with people about their diet and how do we, make small changes. If I ask somebody that, they're going to look at me and be like, I think I don't know. So that's why I think writing things down, or what I've done in the past when I've done any kind of tracking for myself, is I've had the calendar, like a plain calendar, and I will put a star or a happy face for whatever goal it is that I'm working on, right? So for me at the time, it was, I want to increase the number of days I'm literally lifting weights. That's very important to me. I want to feel strong. I want to work on bone health. And that's something I deeply value. And so I thought, okay, well, since I can't remember a lot of things and I'm such a visual person, I like to see, oh, look, I did it 3 times this week. Oh, I did it 2 times this week. And so like the compounding effect, you can see that after a whole month and you're like, oh my gosh, I just did all this work. Like this feels really good. And I think that reinforces, hey, I'm very capable. This is a realistic way to go about, achieving this goal. And so I think that's really great. And so I'm totally with you about celebrating the wins, acknowledging what is working for you, acknowledging the efforts you're putting in, right? Even if it's, I don't know how to lift weights, I'm going to go figure it out. And you just do some bicep curls and you're like, hey, that's new for me. Like that's a really big deal. Absolutely. And when we start to shift, our thoughts to like celebrating the wins and feeling more positive about it, right? Do you notice when people do that, does it kind of turn the volume down on like the negative talk or the judgment? Does it do you shift out of that, or is that hard to do?
Well, I love that you brought that up, because that's another habit. We tend to default the style of thinking that we have. So if we tend to be hard on ourselves, if we tend to hear that critic voice a little more often, we want to look at that. That doesn't have to be that way. We can work on that. So we can work on challenging that voice. The critic voice says, oh, you didn't go to the gym yesterday. You're not doing very good. The encouraging voice says, you took yesterday off and you did your best. And today we have an opportunity to do something else.
Right.
So that is another habit to build, is to have self-compassion and have grace while still holding ourselves accountable to taking care of ourselves. And that
absolutely.
also takes a lot of time and effort to be mindful of thinking about our choices in a more optimistic and more helpful way.
Health challenges can feel overwhelming, but expert home care can bring peace of mind. With PPMA at Home, you get access to trusted professional caregivers who provide skilled nursing, therapy, wound care, and more, all in the comfort of your own home. Recover faster, feel supported, and stay connected to your physician and care team with 24/7 communication. PPMA at Home, because healing happens best when you're where you belong. Call today to learn more.
What you just said makes me think about the practice of gratitude. So when we start to focus on, again, like I know we're using an example of somebody who's new to the gym or new to weight training, right? And instead of beating ourselves up over, why don't I know how to do this? Or this seems really hard, as it should be, because it's new. Exactly. That's the other thing too. We always think we should get something right away
that we don't know how to do.
Yeah. And I've done that before. And it does take a lot of like training and rewiring that habit of thinking like, why didn't I get it right on the first time? And just being able to give yourself the grace to fail and not get it right. And it's okay to ask for help, right? But on the gratitude side, have you noticed like when people practice gratitude, even if it's like, 2 minutes a day, or you're like, these 3 things I've noticed today are really, are positively impacting my life. For example, I had the courage to go into the weight room today. That feels really good. Yeah. I had the courage to ask for help. I was brave, right? So like acknowledging those things, I think falls under the practice of gratitude.
Absolutely. Well, like having self-compassion, having kind thoughts, choosing gratitude, all of that helps activate the reward centers in our brain. So kind of in short, is this helps release dopamine and serotonin, which makes us feel better about what we're doing. And this reduces our stress hormones like cortisol, so that negative talk, right? So choosing gratitude. I'm so grateful I was able to go for a 15-minute walk today. It felt so good to move my body. Or I'm so grateful I did that for myself.
Yeah.
So we're actually releasing these hormones that are really helpful in our motivation. So again, that practice of moving, it's really moving towards what we want to do and not focusing on what we don't want.
Oh, I like that. This is feeling really good in my soul right now, having this conversation, because I think like we all need these reminders, whether you're really new to just the idea of self-talk or understanding what black and white thinking is, right? Or if you're an expert, right? I think having these reminders can be super helpful, especially when we're doing the goals and, finding the habits and trying to be the healthiest version of ourselves, right?
Mm-hmm.
It comes back to, okay, you're doing a great job, Meg.
Mm-hmm.
Hey, way to go, right?
Mm-hmm.
I was able to do XYZ, no matter how tiny that is. And I've noticed like I do that for myself and I'm like, yeah, that was pretty good.
Yeah.
All right. And then you celebrate yourself and there's nothing negative that comes out of it, right? You do feel better.
Yeah. The key to habit change is making it more pleasurable, making it easier. And so if we have positive associations with the habits we're trying to change, it just becomes a more joyful experience versus the more condemning attitude of, I should do this or I should have done that, which is more shame-based. Versus like, I really enjoy taking care of myself. I'm glad to take these little respites. I don't always have all the time I'd like to have, but I have some time. So finding joy in it makes it a lot easier to follow through on.
I like that you said the words, I should, right? And how that's not like the best way to look at things, right? Because I hear that a ton. I hear that a lot where people will say, well, I didn't do this, I should be doing that. And you just see their facial expressions and hear the tone, like they're coming down on themselves. I go, wait a minute, let's change that. Like, let's reword that. Say, okay, well, this is what happened. Let's talk about why it happened. Okay. So what, would feel better in your body, right? So let's figure out how we can go down that path instead, right?
So I think as a motivator, not a shame opportunity.
Exactly. So I'm glad that you brought that up because I do hear a lot of people saying, oh, I should be, and that goes down the negative path. So one question I do have today is specifically about environment. We hear how our environment can shape our behaviors, right? Good or not so good. And so in the nutrition world, right, we talk about the kitchen. What do you have in your kitchen that's going to help push you down the path of like making really great choices? Or are there certain foods or, visual cues that drive you to, the not so great choices, right? So environment is a really big influencing factor. Sometimes people are unaware of this. So what are some ways that people can design their environment to help make those goals easier to achieve?
Yeah. Well, you said visual cues. So that makes me think that's a sort of a premise you can apply a lot of ways. So if we've been talking about working out as a big one, because that's just a really common goal, but having like laying out your workout clothes, or I will put out my water bottle and maybe my protein powder, and I'll line everything up the night before. So in the morning when maybe I'm not as sharp and I'm kind of just getting going with my day, I've already done half the work. So it's there, I see it, it's laid out. I also, it seems very simple, but I tell people to find like mantras or inspiring quotes or any kind of reminders and put them where you can see them visually to remind yourself what your goals are for the day.
Yeah.
Like timers in your phone. You might have if we're talking in terms of like some of the goals we mentioned today, it might be a little post-it that says, I am a healthy person. And that's a reminder over and over and over that I am somebody who chooses healthy behaviors.
Yes.
And so it just helps us anchor our thoughts on what our goals are. So instead of thinking like these big, giant, big goals is like, I'm a healthy person. What would a healthy person do right now? A healthy person would get up and stretch and get a glass of water before they went to their next meeting.
Yeah, that's it. Yeah. And that's that identity part. Yeah. So when you start to like embody that identity, you go, oh yeah, And now my behaviors are starting to reflect that. I really like that.
Yeah. So your point about is looking at your environment, how can I make my environment conducive to the goals I have? A lot of people will say, I want to read more books. So having a little reading station with whatever your book or your digital option or your reading glasses or whatever you need, having it out front and center. So whatever it is that you can help yourself to make it easier and more accessible to follow through.
Yeah, I like that. I'm thinking, as we're talking about the visual cues and our environment, I think about what's in your refrigerator and what is at eye level and what's in your pantry and all of that. And so if you're, hey, I'm the healthy person, I make good choices. Well, first step is figuring out what's in my pantry and what's in my direct line of sight every time I open the fridge, right? I know, for example, there's a type of cookie I really enjoy. And I know when I see it sitting out on the counter or somewhere that's line of sight, man, I'm going for that. Because
it's like a suggestion.
Yeah, exactly. So you either have some phenomenal discipline and you're like, I will have the serving size of 2 cookies, which I think is challenging. I'd rather just not buy it, right? Yeah. Or you put it down below where it's harder to get.
Out of sight, out of mind, hopefully.
Yeah, exactly. So as we wrap up, I'd love to ask one final question. If someone feels stuck or overwhelmed or afraid to set goals because of the failure aspect, what is one thing that you would want them to know?
For people who feel stuck, like they feel like this didn't work in the past, so it's not going to work in the future. Is that what you're saying?
Yeah.
And I hear people say that a lot. And it is a self-defeating philosophy and sort of makes it easy to not even try. But what we can do is look at the past and why didn't it work? What were the obstacles in the way that made it harder? Like we've talked about, usually the goals were too lofty.
Right.
And there's a great technique for setting goals called SMART, S-M-A-R-T. I'm sure you've heard of that. But the acronym leads people to, it's to be specific, measurable, achievable, relevant, and time-bound.
Right.
So really, often we are not specific enough about our goal. I want to be healthier. That means something different for everybody.
Right.
I want to go to the gym more. Also, what does that mean? So instead of looking back on what didn't work, is to try to make the goal smaller, measurable, and have a time constraint. Maybe just try something for 30 days. I'm gonna go to bed early for 30 days, and I'm just gonna do an experiment, and I'm gonna see how I feel, and then I'm going to assess that and decide what I would want to do for the next 30 days.
Right.
So fundamentally, it's looking back, what got in the way before that I could do different this time.
Yes. It's that self-reflection piece. So if we have to be willing to, look back at what we've tried and what didn't work, like what got in the way, and also remembering to remove the judgment, because again, it's okay if we didn't get it right on the first time, right? Or even the first 10 times, it's okay. Then we just reevaluate, right? And then we watch our language with not I should have, or darn it didn't work again. It's okay. Well, maybe we need to just tweak this factor, or maybe it's unrealistic to think, I'm going to go to the gym at 5 a.m., right? When it's well, maybe there's another time in the day that's going to help you be more successful with that.
To look at it differently, maybe have a friend or a professional kind of help you negotiate these goals, give you a little outside feedback.
Yeah.
And I think just the big thing is to remember that you are moving in a direction. Any progress is great.
Yeah.
And if it takes a person a year to establish a really healthy routine around movement or food or what have you, I think that's better than not starting at all. If it takes you a while, at least you're moving in a direction.
Right. Exactly.
It's all valuable.
Exactly. Yeah. Well, with that, I invite all of our listeners to take an assessment, evaluate where you are, where do you want to go, what's worked for you in the past. And if you need to talk to either of us, here we are for you. So Dr. Kvamme, thank you for being here today. I really appreciate it.
This is great. Thank you for having me.
Yeah, thank you. And all of you listeners, thank you for joining us. And as always, you can like and follow us on Spotify and Apple Podcasts, and we will see you next time. Thanks so much. Bye.
Bye.
Thank you for joining us for today's episode of Nourish MD, Doctor Dietitian Dialogues. This podcast is intended for general educational purposes only. It is not a substitute for professional medical advice. Please consult with your healthcare provider before beginning any nutrition or supplement recommendations. Sign up for our mailing list so you'll never miss an episode of our wellness journey. See the podcast description for the link.